Hello, Facial Palsy here and Bellspalsy here. It's Thursday, and today I just want to go over something that I get questions almost on the daily from people online, on YouTube, on Instagram, on my Facebook group, and asking me what stretch they should be doing, what is the proper way to stretch, and I've posted quite a few things already online, but the main thing to understand is that there is not one stretch that is going to address your the entire problem here. Everybody has a unique presentation. There's no two people alike, and what you're going to need to do stretch-wise is going to depend on what is tight, what is not moving, what is restricting. Also depend on the stage you're in of your recovery. Are you 3 days into your Bell's palsy, or are you 4 months, or are you 8 months? And do you have synkinesis? And all of these other questions, just like any other medical problem, this is not something I can treat with just one answer and tell you, or just one exercise to show you. I work with my patient for many appointments. I see patients generally every 3 weeks or every month. Sometimes as the things improve, it's every other month. But facial therapy takes a while, and everybody should know that. It's generally, most people are in facial therapy between 12 and 18 months total. That doesn't mean that it's every month necessarily, or definitely not every week. But that takes time, and it takes time to figure out also, especially when I see patient in person, to figure out how to properly position your fingers to stretch the area of the muscle or of the face that is tight, and to be efficient at it. The more you progress, the more specific you have to be. And that is something that I cannot just teach just through a video. This is like one-on-one training with a patient. And just like any other medical care that I think are of worth, it is just not possible to give a one blanket answers to everybody's problem. That's just not a thing. And I think that's very important for people to understand. And it's not that that I don't want to do that. It's just that it's just not possible. I can't recommend a specific technique or a specific stretch when I have not seen the patient, and I have not seen what it looks like. So yeah, I mean, I have a class available which cover lots of things, and I think that's very valuable for people that are within their first 3 months of their facial palsy. But it's not also going to necessarily address everything. It can be very helpful, and especially if you one of those people, about 2/3 of the people that have just a mild nerve injury, neuropraxia, you will likely recover in 3 months, and these will be very likely more than enough to get you there. But for people that have struggled a little bit more and have delayed healing, I just cannot recommend more working with someone, just like you would for if you have any other type of problem, and if you have back problem, neck problem, knee surgery, you would go see a physical therapist. You just don't cure yourself with just one particular technique that you will find online. So I think that was very important to review, and just for people to understand. Not that I also have necessarily the time to answer every single one, even if it was a thing and possible. I answer things when I can. It can be very general because without more assessment, without more data, I just cannot do a proper job, and I just refuse to do a bad job at this. So I think that's important for everybody to understand. Anyway, I've talked too long already. Have a great weekend, and I talk to you later. Bye bye.